Good afternoon, everyone. Thank you for joining us today. My name is Sandra Taylor. I'm the Executive Director of the Georgetown Hospital Foundation, and it's my pleasure to welcome you to our town hall today. We are excited to be connecting with you, although it's a different format than you're probably used to if you're normally attending our special events, but we're glad you could join us online today. We've gathered a wonderful panel of experts. You will soon hear from them to receive an update on the activities at Georgetown Hospital over the last few months and how we are moving forward. First today, I would like to thank our generous sponsor, Amoco, and their newest development, the Mill Landing in Georgetown. Amoco is an ongoing sponsor of the hospital. Some of you will remember attending our Women's Health Forum at their beautiful model suite for the 42 Mill Street development last fall. This new Amoco project will provide modern luxury condos right in the heart of Georgetown. And for more information, please visit their website, themilllanding.com. Thank you, Amoco, for your sponsorship. Just like Amoco, our community continues to show how much they care for our hospital. I would like to extend our heartfelt thanks to you and all of our donors for your generous and ongoing support. On September 27th, we hosted our annual Walk or Run for Georgetown Hospital. And just like today's town hall, that event had a virtual twist. It was so exciting to see the community come together and support our local hospital. I was able to get out the morning of the event, and I could see participants from all across the region proudly wearing their bright orange t-shirts as they walked or ran in their small groups, socially distanced, of course. The event results exceeded all of our expectations, raising a record of $70,000 for our hospital. And just like all the funds raised by the foundation, this will go towards supporting the highest priority needs at the hospital, which includes new hospital beds and other equipment. As we head into the next couple of months, we have a number of new initiatives and events to share with you. We have just launched a new 50-50 online lottery. Sales have been extremely strong to start, and as of right now, you can win a minimum of $5,000. To purchase your lottery ticket, please go online to georgetown5050.com. If you're looking for an evening out, on November 13th, we will be hosting a drive-in movie night at the 5 Drive-In Theater in Oakville. We are partnering with the other 2 Halton Healthcare Hospital Foundations, and our plan is to start the holiday season by celebrating our healthcare heroes while raising funds to support the work they do. For more information on this event, you can visit our website at georgetownhospitalfoundation.ca and keep an eye on our social media, as over the next couple of weeks, you'll see a lot more information on this event. Lastly, I want to share with you that our holiday fundraising campaign will start next week. And thanks to a very generous family in our community, all donations to this campaign will be matched, which doubles all of your generous support. We will be raising money for surgical equipment. And as you know, the surgery area was one of the areas that had to ramp down at the start of the pandemic. So we want to make sure that the physicians and nurses and all of the surgical team has the best equipment to keep them going at the highest capacity that they can do at this time. On behalf of Peggy, Connor, and Jeff, the other foundation staff, I'd like to thank you for all you do to support Georgetown Hospital. You have truly stepped up to help your hospital, and you're having a positive impact on the patients and families that the hospital serves. To provide further information on how your support impacts Georgetown Hospital and the hospital's plans moving forward, I would like to now introduce our panel for today. Our speakers include Cindy McDonell, Chief Operating Officer at Georgetown Hospital. Cindy will be providing us with an overview of our response to the pandemic, including the latest information about our restart activities and patient visiting. Dr. Michael Zettler, Emergency Department Physician and Hospitalist at Georgetown Hospital, will then be speaking about the emergency department experience during COVID-19 and the importance of taking care of your health needs at this time. And we're pleased to have Dr. Ananda Ghosh, who is physician leader, quality and patient safety, as well as medical lead on COVID-19 assessment and testing centers at Halton Healthcare. And he'll be providing us with some insight into the testing and assessment centers, as well as the current trends we are seeing in the region and the province. The format for our town hall will be very straightforward. Our speakers will each take turns providing their remarks, and then we will follow up with a question and answer period. We have some questions that have been submitted in advance, but we will be accepting questions. So if you are on Zoom, you can use the question and answer function at the bottom. Or if you're watching on Facebook Live, you can ask your question in the Facebook comment box. So to get us started, I'd now like to welcome Cindy McDonell, Chief Operating Officer at Georgetown Hospital. And because we are social distancing, I'm just going to slide out and Cindy's going to take my spot.
Thank you very much, Sandra. It's great to be here today. And although it's a bit clumsy sliding in and out, I'm very grateful for the opportunity to speak to you this morning without having to wear a mask. So thanks for that. And thank you for joining us. Your ongoing interest in what's happening at the hospital and what's happening with us is very much appreciated. So we're glad to have you here. Lots has happened since March 15th, I can tell you that. But if you remember back to those early days, the Ministry of Health directed hospitals to significantly decrease we call it our scheduled surgical and procedural work. This is work that isn't urgent or emergent. And the reason for that direction was concern that our healthcare system could be overwhelmed by COVID cases. Looking back in those busy days of March, I don't believe any of us would have predicted the path that this pandemic has taken. But fortunately, our organization was well positioned to respond to this global healthcare crisis, thanks to primarily infrastructure investments that we've operationalized in all three of our communities during recent years. Careful planning and emergency preparedness, including support from donors for priority equipment, has been key to fighting COVID-19 for us. Although we've had to make changes to the way our hospitals operate, we have continued to provide essential services such as emergency services, urgent surgeries, and cancer cases. Our COVID-19 pandemic response plan was created with a view to ensuring that our three hospitals, acting as one healthcare system, mounted a coordinated response to what we believed would be a surge of COVID-19 patients. Our ramp down activities ensured we were limited in screening the number of people who were coming into our buildings to protect our patients and the staff, including some fairly dramatic changes to our visiting policy. All necessary precautions in the face of a very serious public health risk. And we were also prepared and called upon to assist our partners in long-term care and retirement homes, who were having a much more difficult time managing the impact of this pandemic on their very vulnerable populations. Since mid-June, our teams have been navigating the complex work associated with returning to pre-pandemic levels of clinical activity and patient volumes. And it may be of interest to you to know that it's been a lot more work and a lot more complex bringing the services back online than it was ramping them down in the first place. We've been very mindful not to rush this process. It's been a carefully thought out, gradual increase of clinical services. We are now back to our pre-COVID levels of activity, and we have initiated the work to rebook the clinical activity that was postponed in the early months of this crisis. And we are starting to see the gradual return of volunteers across the three Halton healthcare hospitals, and we're very grateful for that. These are positive steps forward, but steps that we need to approach with caution to ensure the ongoing safety of our patients, staff, and physicians. Our internal emergency operations team, who have met every day since the beginning in March, will continue to monitor key indicators, including our occupancy of all three hospitals on a daily and weekly basis. We need to be ready to respond to any resurgence of COVID-19 in our communities. So we continue to ask for everyone's patience. If you've had surgery or a procedure postponed and you feel your situation is becoming more urgent, I urge you to contact your physician or surgeon and have a discussion about that. Today, there are still many safety measures in place to protect everyone's health and safety that will continue for the foreseeable future. Everyone must continue to pass active screening before entering our facilities, and that includes all of us, physicians, staff, volunteers, patients, visitors. And we're all asked to follow our guidelines, including frequent hand washing, maintaining physical distancing, and limiting travel inside our buildings. And of course, everyone entering our hospitals will be asked to wear a mask. We know visiting restrictions implemented during the COVID-19 pandemic have had a negative impact on our patients and their families. While some limited visitors were permitted on compassionate grounds, and our virtual visiting program has been hugely successful, there really is no comparison to an in-person visit from a loved one. As we begin to resume clinical services, we have gradually welcomed visitors back to our hospital. Visitors are required to complete screening process, wear a mask at all times, and maintain physical distancing when in the hospital. Our current visiting process is not a complete return to pre-COVID times. There are still many restrictions, and there will be for the future, for the safety of our patients, our healthcare workers, and for the visitors themselves. We've done our best to accommodate exceptional circumstances, and our current processes allow all patients to have one visitor every day for a designated 3-hour time period. We're also starting to allow one essential visitor to accompany patients in the emergency department. We really appreciate everyone's support of these new rules. We know it's difficult. The visiting policy is flexible, so we can return to a previous phase should those circumstances present themselves, and exceptions continue to be considered and approved on a case-by-case basis. The best place to get information on our visiting policy is on the Halton Healthcare website, www.haltonhealthcare.com. Please click on the COVID-19 section and you'll find information on visiting guidelines, as well as information about our virtual visiting program. I can't tell you how proud we are of our physicians, our staff, and the leaders of this organization who've been supporting our response to protect our community as we continue to fulfill our vision of providing exemplary patient care during these unprecedented times. On behalf of everyone at Halton Healthcare, thank you for doing your part by staying home, staying safe, and practicing physical distancing. And again, thank you for your ongoing support of Georgetown Hospital. It's been amazing. We saw and heard from you all spring. We witnessed the parades of orange shirts supporting the walk or run across Halton Hills. We feel your support and your care for us, and we want to remind you that the hospital is a safe place and we're always here for you. To share with you more about what you can expect should you need to come to the hospital, I'm now going to turn the town hall over to Dr. Mike Zettler, who's an emergency physician and hospitalist here at Georgetown Hospital. Mike?
Thanks, Cindy. In March early this year, as we all heard of the increasing case numbers of COVID-19 across our country, and the Ministry of Health issued directives to our hospitals to ramp down certain services. One thing that my colleagues and I never expected was that our emergency department would be, at the time, so quiet. It was actually a phenomenon that had occurred right across the country. As the pandemic spread, so did the fear of coming to the hospital. And unfortunately, for a few of those who needed it, delay in coming to the hospital for some had a significant impact on their recovery. I recall one very stoic patient that I helped care for in the early spring. This patient had been experiencing abdominal pain, and day by day it got gradually worse. Eventually the pain was unbearable, and the patient started to feel weaker, sicker, feverish. And so after more than a week, they came into the Georgetown Hospital Emergency Department. We knew right away that something was wrong and went ahead with a number of tests, including a CT scan. The patient was unfortunately diagnosed with a ruptured appendix, complicated by an abscess in the abdomen. This is a significant complication of appendicitis, and one that generally doesn't occur until it has been going on for some time. I consulted with our general surgeon on call, who took over the patient's care. And after an operation, the patient was doing much better, but their recovery was certainly slower and their stay in hospital longer than it would have been had the appendix not ruptured. The patient expressed to me that they were at the time afraid to come to the hospital during the pandemic, even though they knew something was wrong. They also expressed a desire to save hospital resources for someone else, which is certainly a selfless goal, but unfortunately not ideal in that situation. And so, while we have daily reports of numbers of cases of COVID-19, which is very critical data to our pandemic response, sometimes cases like this are not captured in the statistics. So I think it is important to remember that our hospitals, even in the peak of a pandemic, are perhaps among the safest places because we are prepared. Even in an older building such as ours, we are equipped and prepared to respond to many crises, including a pandemic as one of them. We have the appropriate capacity to deal and look after patients with contagious diseases. We have isolation rooms, negative pressure rooms, personal protective equipment, and a very highly trained healthcare team. We also continue to have the capacity to care for those with illnesses that are totally unrelated to the pandemic, like an appendicitis. Thankfully, over the past few months, we've noticed that this fear of coming to the emergency department has mostly subsided. We are seeing roughly the same numbers of patients as we did at this time last year. But there are some differences in what one might expect if they need to come to the emergency department. The first and very obvious one is the active screening that Cindy mentioned, where everyone entering the hospital is asked a series of questions about symptoms that may be related to COVID-19. Everyone entering the hospital, again, that's patients, visitors, as well as all staff, are expected to wear a mask. And so you will be provided one if you don't have your own. We have even more hand sanitizer stations, which I didn't initially think was even possible. So you'll be asked to clean your hands upon entry, and it's a good idea to do so frequently throughout the visitor stay. I also provided an information sheet on some of the do's and don'ts of being in the emergency department and proper mask use. Part of that involves, of course, covering the nose and mouth. We do also try to maintain everyone's physical distance from one another while in the emergency department, including in the waiting areas and in the treatment areas. Because of the unpredictable nature of the emergency and sometimes the fact that it is quite busy, 2 meters between everyone is not always possible. And so the importance of mask use and hand hygiene is emphasized. After that, a patient's care in the emergency department would meet the same high standards of quality that we always strive for. We have isolation rooms and isolation protocols for those who need it, including things like taking a chest x-ray right in a patient's room if needed. I would point out that we have new and very high quality portable x-ray equipment that was purchased with the incredible support of the Georgetown Hospital Foundation. All our staff have enough personal protective equipment to safely care for our patients, but you will see different types depending on the scenario. A simple surgical mask and face protection may be all that's needed to look after a patient with a broken ankle, but N95 masks, full gowns, and other items may be used when we're caring for our sickest patients needing intensive care. I'd also like to speak just briefly about something that may help keep you and your loved ones out of the emergency department this fall and this winter. With the potential for influenza virus circulating, as well as the coronavirus causing COVID-19, it's more important than ever to do everything we can to stay healthy. And that's why I'd like to encourage everyone to consider getting their influenza vaccine this year. It will help protect you, it helps protect loved ones, and it helps protect our communities from spread of the influenza virus. It also might help reduce the impact on our healthcare system as we are currently fighting another wave of this pandemic. So the flu shot is a great thing. It's recommended for everyone from 6 months of age all the way throughout life. It's very safe, including for kids. I've had it for my own kids. It's also safe for pregnant women and breastfeeding and those with a whole host of different medical conditions. It's free, which not much is these days. And it should be widely available as supplies are going out into the communities now from your family doctor, from walk-in clinics, and from participating pharmacies. The influenza virus is different every year, and so the influenza vaccine is also different every year. It is important to get it every fall, even if you have had it in the past. So I'd just like to finish off by reminding you that the emergency department is a safe place to be, as is the remainder of our hospital, including all those who need to stay in the hospital or come in for surgery. We're well prepared for the pandemic, and we are able to treat all different types of conditions, whether it may be a suspected COVID-19 or any other condition. So I encourage everyone to not delay in seeking their care if we need it. I'd also like to invite to speak now Dr. Ananda Ghosh, an infectious disease specialist and our physician lead for quality and patient safety, and the medical leader for our COVID-19 assessment and testing centers at Halton Healthcare. Ananda?
Thanks, Mike. Thanks very much. Let me just take a second to start sharing my screen. Okay, hopefully everybody can see that. So thanks very much for the opportunity to talk today. I'm going to spend a little bit of time talking about some of our local COVID activity, as well as the impact that this has been having on our hospitals at Halton Healthcare. And then I would like to take some time to provide some updates and information about our assessment centers, which have certainly been one of our most visible responses to the pandemic. Before I get started, I will apologize that I am currently on call. So if you start hearing some dings or buzzes, I'm just not able to turn off my pager and silence things as I normally would for a talk like this. So with that said, let's get started. So this is what I'm showing here is the number of COVID cases in Halton region. And so this is the number of new cases of COVID each day over time from the start of the pandemic until about last week. So in total in our region, in Halton region, there have been almost 2,000 cases. And presently there are just over 200 active cases within Halton region. Spending just a little bit more time here, certainly what we can see is that the first wave of the pandemic occurred and peaked in our region in late April and early May. And we had an ongoing, very low level of disease activity through the summer. But we can see that as the fall came, we have had a so-called second wave or a rise in number of daily cases. And in fact, the peak number of daily cases we're seeing now is actually higher than it was during the peak of the first wave. Looking more closely at Halton Hills, where Georgetown services, we can see a similar pattern, but obviously the numbers are much lower given the smaller population. And so to date, there have been a total of almost 250 cases of COVID-19 in Halton Hills. And presently there are 13 active cases currently. And we certainly do see a similar pattern where the peak of the first wave occurred in late April and early May. And we have also seen a rise in the fall, although not to the same degree as other parts of Halton region thus far. So in terms of the impact that this has had on our hospitals, now I did prepare these slides over the weekend. So the most current numbers are that we have 13 admitted patients across our hospitals at Halton Healthcare. And there are 2 admitted patients at Georgetown Hospital presently. But fortunately, none of the patients with COVID-19 are requiring ICU level care, which is great news. So what this graph is showing is in the light yellow is the number of admitted patients with COVID-19 who were on our ward beds. And the dark yellow is the number of admitted COVID patients who were requiring ICU care beds. And so we can see that our hospital admissions or the so-called hospital burden of disease also similarly peaked through April in the first wave with ward beds and ICU beds being in demand. And then there was a steady decline. I will comment about this wave in June. This is actually not a result of increased cases or use in our region. What was happening at this point is neighboring regions, there were long-term care homes that were in crisis and their local hospitals were overwhelmed. And so as good health system partners at Halton Healthcare, we did take on a number of patients who required admission for COVID-19 from outside of our region who did stay within our hospital for some time. And so this wave is not really a reflection of activity in the Halton region. And we can see that through the summer, we had very few admitted patients due to COVID-19, but as number of cases in the community in the fall have picked up, we have also similarly seen an increase in the number of admitted patients. But what I would point out is, as you can see thus far, this second wave of hospitalized patients is notably smaller than what we saw in the first wave. And so to try and put this in some context, I'm actually going to overlay the number of active cases in our community over these numbers for patients that are actually admitted in our hospital. So here, the dark gray is the number of active cases in Halton region. And now much lower is the yellow is the number of admitted patients to the ward, and the very small bar at the bottom is the number of ICU level patients. And so the reason I wanted to put this forward is that we can see, although we're seeing higher numbers of cases in the community, that has not yet resulted in as many hospitalized patients. So of course, the question for that is why? And so I think there are a couple of reasons to flag or highlight for this. So the first is that certainly there's improved access to testing now compared to during the first wave. And certainly I'll speak about the assessment centers that are doing much of this testing. And so the truth is probably the first wave was quite a bit larger than we were able to capture or prove. And there were probably a number of cases that occurred and resolved without ever being tested and thus being captured in the numbers. But the second reason is that in the second wave, it is clear that it is a different group or cohort of people who are being infected. And in general, it is younger people being infected so far in the second wave. So to demonstrate this, this is a couple of graphs. So this is looking at Halton region in general. And this is a breakdown of all the people who were found to have COVID during the first wave, so March and April. And so we can see that the majority were in the age group 40 to 59, but beyond that, there were a substantial number of COVID patients age 60 and above. And when we compare that across Halton region to the second wave, we can see there's a significant shift where the number of COVID infections is much higher in the 20 to 39 age group and substantially higher in the 0 to 19 age group, without a corresponding rise in our older age groups. And if these graphs don't convince you, certainly that's even more pronounced within Halton Hills itself. So we can see during the first wave, the majority of our cases was in those aged 80 plus, whereas currently in second wave so far, the majority of our cases are in those aged below 40. And as it turns out, age is the single biggest predictor of outcome with COVID infection. And so what this top graph is showing is the probability of being hospitalized if one is found to have COVID, broken down by decade of age. And we can see the probability of being hospitalized rises significantly if the patient's age is greater than 60. And similarly related, the probability of having the worst outcome, death, is also directly related to the age of the patient. And indeed, of all the nearly 2,000 cases we've had, there have been no deaths in Halton region in anyone who's had COVID under the age of 40. And so part of this second wave is also that it has not at this time, and we'll cross our fingers that it continues to be the case, not hit long-term care homes in the same way. And so we can see a significant proportion of cases through the first wave was a result of outbreaks in long-term care homes. And thus far, although we're seeing lots of cases in the second wave, the number of cases in long-term care homes has not risen to the same degree yet. Based on the information I just presented about the importance of age predicting outcome, we'll certainly have to do our best to support our long-term care homes. And I know Cindy's actively involved in that to try and protect our most vulnerable. Okay, so with that, I'll shift gears a little bit to provide some information about our assessment centers. As I mentioned, certainly have been one of the most active and visible parts of our response to the pandemic and how we've tried to support the community. So at Halton Healthcare, we have been operating 3 assessment centers, one in each of our communities, and these have been operating since early March of this year. And to date, we've tested over 65,000 residents, and Georgetown Hospital's assessment center has done 16,500 of those. So certainly a big contribution to our overall total. And presently, the capacity of our assessment centers is that we can book and test 950 patients a day for COVID testing. And in Georgetown Hospital itself, 225 can be done a day. So this is just to give you a sense of the volumes or the number of people that we have tested in our assessment center through the pandemic. So this graph again has time along the bottom, and this shows the number of people tested at each center, with Georgetown in the blue bar and the yellow bar being the total across our 3 assessment centers. And just a few things that I'll pause to point out with this graph. So through the early part of the pandemic into March and April, at that time, we had a number of restrictions in terms of who we were able to test. So there were specified criteria set by the province about who should get a test. Those who had symptoms, those who had exposures, but not even all of those people were tested. There were further restrictions to high priority groups who were those who were most likely to get sick from COVID and those who were most likely to spread COVID to vulnerable populations. But we can all, I certainly remember a Sunday afternoon where the Premier eliminated those testing criteria, and you all may remember it was on TV saying that everybody should go get tested. Bring your friends, bring your family, nobody will be turned away. And as a result of that, certainly we saw a significant increase in the volume of our assessment centers. And we were largely able to accommodate those volumes by extending hours at the Oakville site and improving our efficiencies at the assessment centers as best we could. And so through most of the summer, we were running steady at about 300 tests per day, and our capacity at that time went to about 340 tests a day was the maximum that we could achieve. However, we knew that a wave of demand was going to come when schools reopened and with the fall wave. And so we had plans in place to significantly expand our capacity to meet our community's needs. These plans involved making further process improvements to streamline the process and also adding significant resources. And through a lot of hard work and a lot of teamwork, we were actually able to triple our capacity within a span of 10 days. So on the 14th of September, we did our then maximum of 340 tests a day. And a short 10 days later, we did 990 tests in a single day. So that was a really great achievement for Halton Healthcare. But no good deed goes unpunished. And the very day that we hit that maximum number of 990 tests, all of these things have downstream consequences. And so with everyone in the province increasing their testing so significantly, basically our lab system became overwhelmed and the wait times for tests became very long. And so that prompted the provincial government to once again reintroduce testing criteria. So we're once again focused on testing patients who have symptoms, which means they could be sick with COVID-19 or who've had exposures to COVID-19. And we've seen with the reintroduction of those testing criteria a fall in our testing volumes, though we do maintain the capacity at our assessment centers. And so it's good news because that means that we have lots of capacity to offer people appointments when they need them. So I'll just go through a little bit about what to expect if you do need to visit one of our assessment centers. So the first step would be to make an appointment. And so we've always run our assessment centers on a by appointment only model. And this is primarily a matter of safety. We wanted to make sure that we were avoiding crowding and that everyone could maintain safe distance from one another when they were visiting our assessment centers. The added values of having an appointment model is that it avoids long wait times and it guarantees that everyone who comes to the assessment center will get tested. We've certainly seen lots and lots of news stories about patients who might have visited other assessment centers, waited in line for 4 or 5 hours, and then only to be told that they could not get a test that day because the assessment center was closing. We've had a by appointment model from the beginning, and indeed now all assessment centers are mandated to have a by appointment model. And so appointments can be made either online. We have a website that allows booking for appointments up to 7 days in advance. These online appointments do go quickly, and so there's a lot of messaging on the website that if one cannot find an appointment in a timely fashion online, to please call our booking line. We do reserve appointments to make sure that we can get people seen in a timely fashion. And at this time, we're certainly able to offer same day or next day appointments. So appointments are certainly available within 24 hours. So at the time of making your appointment, you'll be given information about exactly where to go for the assessment center. And so each assessment center does have a designated parking area. And when you enter the assessment center, you'll be provided a parking pass so that nobody's paying for parking when they're coming for these assessment centers. On arrival, everybody will be provided a hospital grade mask. So even if you wear your own mask, which is encouraged, we'll ask you to take it off and make sure we're giving you a hospital grade high quality mask. From there, you'll visit a registration clerk who will take your information to make sure we know how to get a hold of you if we need to. And then from there, you will meet a nurse who will take the information about any symptoms that you may or may not be having, any exposures you might have had, and help fill out the paperwork. From there, you'll move on to a second nurse who will actually collect the swab. The procedure of having the swab involves basically taking a really long Q-tip and gently inserting it into the nose until it accesses the back part of the nose to get a sample. It's not painful, it's uncomfortable, but our nurses are very skilled and have now literally done thousands, and so do it quite well. And then based on the nurse's assessment and after the swab is collected, if there's any concerns about how you're feeling, you may be also seen by a physician who will do an assessment to determine whether it's safe for you to return home to wait for your results or whether you might need to go to the emergency department. So we certainly want to make sure that we're being as safe as possible and only having people who are safe to go home do so. And indeed, we have had a small handful of patients who've presented to an assessment center, but when they came and were assessed by a physician, they were deemed to be really quite unwell. They went to our emergency departments and in fact have wound up in our ICU within a couple of days of their visit to the assessment center. So we're very proud and happy to continue the physician assessment piece that does occur. And I think it's an important safety measure that we're able to provide. So after the test is collected, then most patients will return home to wait for their result. They'll receive information about whether or not they need to self-isolate and how to self-isolate at home. And then the results are eventually posted on an online portal that the province has provided that most people can access. In the event that there are problems with the online portal, family physicians can also access the results of COVID tests once they're available. And if all of these things are failing, then our booking call center is also there to help people who are not able to get their results through the online portal. So we don't leave people without any support. Now, certainly a topical matter has been the time to get test results. And so presently the tests are returning within 2 to 4 days. And our microbiology lab is working to try and improve our in-house testing capacity because all of the tests that we're able to run in our own hospital lab are turned around much faster, you can imagine, than tests that need to be sent somewhere else to be run at a different lab. Okay, that's all I had to speak about now. I'll turn it back to Jeff and I'll be happy to take questions later on if there are some.
Thank you, Dr. Ghosh. And again, thank you everybody for joining us today. As Sandra mentioned off the top, we'd be very happy to take any questions that you might have. And so please feel free to use the, if you're watching this on Zoom, please feel free to use the chat, the Q&A feature on Zoom to submit your questions. And if you're watching on Facebook Live, you can certainly use the Facebook comment feature to submit your questions as well. And to get us started, we do have a couple questions here. And so Cindy, I think you're on the screen there. Are you okay if I start with you?
Sure.
Great. So Cindy, question is, if cases continue to rise, will we be canceling surgeries in clinics again? What about visitors?
Well, this is a situation that we are assessing daily. As you can see from Ananda's slides, it changes daily. I can tell you that at the moment, we have no plans to cancel surgery or to ramp down our ambulatory clinic visits. But based on our assessment that we do every day, we will do whatever we can to maintain a safe environment for patients and for their families and for physicians and staff. So we'll do what we need to do to maintain that safe environment, and it'll be a daily assessment.
Great. Does a visitor need to have a COVID-19 test done before they can come to the hospital and visit a family member who's here?
No. The short answer to that is no. You don't have to have a proof of a negative COVID test to come to the hospital to visit a family member. Everybody that comes to our hospital, including all of us, has to go through a screening process. We are actively screened when you come into the building. And if you fail the screening test, we won't let you come in. So that's the way that we control it. So a negative test is not required to come to visit. And of course, if you want to have a test or if you think you need to have a test, as Ananda said, there's a means of getting that, but not to come to visit at the hospital.
Great. And Cindy, maybe one more question for you before I turn over to Dr. Zettler. What about PPE? We heard lots of stuff, questions about being shortages in the early days of the pandemic. How's our PPE supply at the hospital right now?
So just as a reminder, everybody, PPE is personal protective equipment. It includes masks, respirators, eye protection, and gowns. And overall, yes, we've had the supplies that we've needed throughout this entire time, but that doesn't mean that we aren't faced on a daily basis with concern about whether or not that supply is going to be there. We're very cognizant, and I think everybody on the line is aware of how a toilet paper crisis was created in March, and we want to be sure that we're not doing the same thing. So there's ongoing procurement via a number of different vendors, and there are channels for obtaining additional PPE if required through our region and through provincial government. In addition to ongoing procurement, we have initiated processes to conserve our existing inventory. We actually have super users, PPE super users, we're calling them, who have the PPE on a cart. They travel around the hospital at all 3 of our sites. And when staff require PPE, they call the super user and the super user brings it to them so that we keep a very tight control on our inventory. And I think it's important also for people to know that we monitor our inventory on a daily basis, and our inventory is reported through our Emergency Operations Center on a daily basis. And I have to tell you that we report it based on the number of days worth of PPE we have, or the number of weeks worth of PPE we have. If someone told you that we have, I'm making this number up, if we had said that we had 10,000 masks, that isn't as probably important to you as knowing that we have 6 weeks worth of masks available on site. So it's reported and it's published. We're pretty transparent about that to our staff. Staff get those reports through our situation report, so everybody's very aware of what our PPE stock is. So far, we have no plans to change that inventory control process.
That's great. Thanks, Cindy, appreciate it. I'm gonna turn it over to Dr. Zettler now. Dr. Zettler, question about coming to the emergency department. Like, how does someone know that they should come to the emergency department and see you guys?
Sure, that's always a bit of a tricky question because it's there's a lot of different answers. I would say that the main thing to think about, as I discussed earlier, is people should not consider the reasons to be different now, even in the course of this COVID-19 pandemic, than the reasons were prior to it. I would emphasize again that the emergency department is a safe place to come when needing emergency medical care. And if we all follow the precautions that we should be undertaking, then the risk of infection from another patient and things like that is very, very low. In fact, I'm not aware of any cases of that in our hospital. In general, the reasons to need to come to an emergency department are symptoms of an illness that is acute, very acute. That means happening quite suddenly, or very severe when the symptoms are not bearable. These are for injuries, illnesses, mental health concerns. We look after the entire spectrum of healthcare. We're not a great substitute for a family doctor, and so things that questions you might have about ongoing medical conditions where the symptoms have not changed, or other things like that, may be most appropriate to speak with your family doctor first. And if they feel you need attention in the emergency department, they'll often let you know that.
Great, thank you. Another question here. Instead of coming to the hospital, could I consult with the emergency department physician virtually?
Unfortunately, that's virtual visits with emergency department physician are not really a reality at this time, although we might have some capability like this. Most of what we do in the emergency department is best done in person. A big part of it is talking face-to-face with our patients, the importance of a physical exam and any tests that we may need to undergo in the emergency department. So that being said, most family doctors' offices and many walk-in clinics are offering virtual visits, sometimes maybe simply as a telephone call or a video chat face-to-face. So if there are questions that, or health concerns you feel might be appropriate for that, I would direct people to those avenues. And again, if a family doctor or a physician at a walk-in clinic feels that you might need emergency attention, they'll often direct you to us.
Great. And Dr. Zettler, one more question for you. I'm over 65 years old. Which vaccine should I get? The regular dose or the high dose vaccine?
Yeah, there are different forms of the influenza vaccine available. There is one that's called a high-dose trivalent vaccine, which is generally recommended for patients over 65 years of age. It might produce a stronger immune response in those whose immune system is less likely to do so. However, the standard dose quadrivalent vaccine that's also available is appropriate for many people over 65 as well. I would emphasize the importance that a flu shot is certainly better than no flu shot. And if you have specific questions about which might be available and which is best for your health status, I think a conversation with a family doctor is a great idea.
Great. Thank you, Dr. Zettler. Appreciate it.
My pleasure.
Over to Dr. Ghosh. Dr. Ghosh, you're there with us?
I am. Hi.
First question is, can anyone get a test? And how do I know if I'm eligible for a COVID-19 test?
Sure. So as I mentioned previously, the criteria for who's eligible for a test is actually set provincially and by the province. And presently there are criteria for who can be tested. Essentially, these center around, do you have symptoms for COVID-19? And there's an extensive list of symptoms. Or have you been exposed to someone who's been confirmed to have COVID-19? And if it's no to either of those questions, then there are some select groups that are still eligible for testing, particularly those who are interacting with our most vulnerable, so those who will be visiting long-term care homes or working in long-term care homes. But the best way to sort out whether or not you should have a test is that there is an online self-assessment tool available by the province, and there are links to the self-assessment tool from the Assessment Center website for Halton Healthcare.
Great. How long does it take to get the test results?
Yeah, so currently the turnaround time for test results is about 2 to 4 days for those tests that we do have to send out, which is the majority of them at this time.
Do you anticipate that we'll be expanding the testing capacity at the Georgetown Hospital?
So it's the challenge at Georgetown Hospital is that there is a bit of a limitation in the physical space. We're very lucky to have the space that we do have, which I understand is actually out of the generosity of the foundation itself. And we've certainly made great use of that space. Because we don't have more physical space to expand to, I think that puts a limit on how much we could expand the capacity at Georgetown Hospital. With that said, adding more staff and improving our processes, we do think we could squeeze a little bit more capacity out there. But we do have opportunities to increase our capacity both in Milton and Oakville. And so certainly as part of the overall Halton Healthcare plan, we do have plans for adding capacity if we need it.
Great. I got a question here about, do you anticipate rapid COVID tests being made available to the hospital?
So we certainly continue to hear about these. The federal government does make announcements about procurement, and I know that our microbiology lab is in touch with the public health lab in Ontario that will ultimately be distributing these tests. In terms of a timeline for when we can expect them, I don't have an answer for that yet. And I think there are probably still some decisions being made at fairly high levels about how best to use these tests. And you know, to offer my own opinion, I'm not sure that the hospitals are actually the best place or the most important place that these should be deployed. If I were making these decisions, I think I would strongly consider long-term care homes as a place where these might be most valuable in protecting our most vulnerable. But I know that our lab is in discussion to have these tests available. We don't have a timeline for them yet, and no decisions have been made about exactly how they'll be used.
Great. Thank you, Dr. Ghosh. This is appreciate all your answers and all the great info today. I'm going to turn the Q&A over to Sandra because we have a couple questions that came in for the foundation here, Sandra. So we'll bring it your way. Great.
I'm ready.
First question was about donations, which is great. And the question is, I often bring my donation directly to the hospital. What's the best way to get it to the hospital, to get it to the foundation this year?
Yes, we love the fact that many of our donors love to drop by, particularly in the holiday season, to see us and drop off their donation. This year, we are asking that maybe you look at a different way to do it. We have lots of different ways you can do it. First, if you get our direct mail, there is a prepaid envelope and you can just pop it in the mailbox. Canada Post is quite reliable and we do get your donations that way. You can certainly call our office if you have a credit card number that you want to give, or you can certainly go on our website and go online to make your gift as well. If you really want to drop it off, you will not be allowed in the hospital, but you can drop it off with the screeners that are at the door. But recognizing that they're pretty busy with visitors and people coming in for appointments, we would encourage you to look at other means of making your donation just for this year, and hopefully next year we can see you back in the office and have a word or two with you when you drop off your gift.
That's great. Sandra, and we had a question come through about the events that we showed earlier on. Where could folks get more information about our upcoming events?
Yeah, so all of our events are on our website, Georgetown Hospital Foundation.ca. And I would encourage people that if they haven't signed up for our e-newsletters, just provide us with your email and it'll come right to your inbox, everything that's going on with us. And of course, if you prefer social media, we're on Facebook, Twitter, Instagram and LinkedIn, and we post all of our information there as well. So take a look for us on social media.
That's great. Thanks, Sandra. That's awesome. We actually had a question come in for Dr. Zettler. So before we wrap up, I just wanted to bring Dr. Zettler back in for one more second to answer one question about the flu shot here. Dr. Zettler, you're coming up.
Hi.
The question is, I've tried to locate the flu vaccine locally and are having trouble finding it. Any suggestions on the best way or the best location to get your flu shot in a timely manner?
Yeah, so this has been a bit of an issue in the recent weeks. The flu shot is out and is available. However, it is quite a logistical undertaking for the flu shot to get out everywhere where it's administered. It comes from a provincial supply. It's distributed to local public health units such as Halton Public Health, and then further distributed to doctors' offices and pharmacies. And so it's a time-consuming process, and they want to make sure that they get enough shots into the right areas to meet the demand. So there are again pharmacies that are offering it, but might not have it available immediately. Similar with doctors' offices. I would emphasize a bit of patience with this is okay. Sooner is good. However, it's the flu season stretches from somewhat in November, but really through December to March, and so there is a bit of time still to get the flu shot, even if it's not immediately available. Also might require a little bit of persistence on our part to be in touch with our doctor's offices or pharmacies for available appointments.
Great, thank you, Dr. Zettler. Sandra, I think we're gonna turn it back over to you and to wrap us up.
Great. Well, thank you, Jeff, and thank you to Cindy, to Dr. Zettler, and to Dr. Ghosh for joining us today. I hope you've all found this to be an informative session, and hopefully gives you confidence in what the hospital is doing, and a little bit of insight into what's happening and what's being planned, given that we're still under a situation where things do change daily. And I think I'd like to give a shout out to the entire hospital leadership team and to all the physicians, nurses, support staff, right through the entire hospital. I've been here every day through the pandemic and seen what they've done, and it is amazing. It's the type of thing you'd like somebody to be able to see, but obviously we're trying to keep people out of the hospital. But everybody's done a tremendous job, and they continue to do that and continue to show flexibility as things change and as more information is known. I think that the hospital has been extremely responsive to that. So I want to thank everybody for joining us today. As you can see, the need for equipment funding at the hospital, which is what the foundation raises money for, is as urgent as ever. So we're very grateful for your ongoing support. Virtually every piece of equipment in the hospital has been funded by donors, just like you. I'd also like to thank Amico for their sponsorship of today's town hall, and remind you and encourage you to visit their website, themilllanding.com, for information on their newest condo development here in Georgetown. We will be sending out a very short post-event survey And really, if you could take a few minutes to fill that out, that would be tremendous. It helps us to see what we might include in future town halls. As you know, it may be a while before we can run a lot of in-person events, so we are trying to keep in touch with you as best as possible. So we really want to hear your feedback. And if you have any other further questions, please reach out and connect with us at the foundation, to Peggy, Connor, Jeff, or myself. And you can see on the screen now the phone number, as well as our website, and of course, all of our social media channels. You can reach us through that as well. So once again, thank you for joining us today. Thank you to our panelists for a very informative discussion today. Stay safe and have a great afternoon.